Hey guys, my name is Brianna Edwards. I'm a first year occupational therapy student at Midwestern University, and today I'll be showing you my occupation-based kit for my activity analysis class. The occupation-based kit that I decided to do was medication management. This kit could be used for most populations, from adolescents to adults. I more focus mine on older adults since they tend to have more medications that need to be managed. I witness I do this with kids if they have the tendency to want to put things in their mouth. I do have beads in this kit, and that could be just a choking hazard. The predominant occupation that this kit works on is instrumental activities of daily living, or IADLs. The activities can be done for people, but being able to do it yourself will give you a great amount of independence and just happiness, because independence, a lot of people just want that back. This kit mainly focuses on being able to sort out your personal and needed medications throughout the week. It can be used for different types of population, different diagnoses, since it works on cognition as well as fine motor skills. So it works on fine motor skills by having them, you need to pinch to hold the pills, or the beads in this case, opening different medicine bottles, which I will show you in a second, opening the pill sorter. And it also works on coordination or cognition, because you have to have, it does involve planning and selection, sequencing, and organizing. So this would be a great way for people who just are recovering from a brain injury or a stroke. So in my kit, I have a weekly pill sorter that has both AM and PM tabs on it. And I just got this from the Dollar Tree, but you can have them at Walmart and Target. And they all are a little bit different. Some have longer little latches on them that overlap, so it's a lot easier to open. So you can easily adapt it to what your patient needs or your family member needs. I also have different pill bottles. I have different ones that are different sizes. I have some that are larger, some that are smaller, just to challenge the patient with grasping different bottles, sizes, and shapes. They also have different lids on them. I want it to be more functional, so I got ones with different lids on them. So some are just push and undo, some you have to hold a tab down, some are like squeeze the sides. So really just to challenge the patient, and that can be a great way to adapt the activity or grade it depending on if they're having trouble opening one or more bottles. You can use the one they're having trouble with more, or use ones they're having trouble easier. I also have different types of beads in here. I have small, medium, and large ones. They're in different colors. So each of the bottles have different color beads in them. Some have smaller beads, some has larger ones. This is a great and easy way you can easily grade up or down this activity. If your patient or client has issues grasping and they're just now starting off to work this activity, I have multiple larger beads in here. And you can always get larger ones than this, as long as they fit in the pill bottles. Make sure you put different ones in different colors in each bottle. I also have ones that are pretty small to help with more fine motor movements, and I have some here that have more texture to them instead of being smooth. So another way you can just grade it up or down for this activity. Lastly, in my box, I have different types of washi tape. These are you can get them at any craft store and are really cheap. I just got ones of different patterns that I put around the bottles, and I will explain why I did that in 1 second. So, I put washi tape around each of the bottles, and each color is different. And I did this so if reading a label is hard for people, they can, just because the font may be too small, or after having a stroke or brain injury, the reading is very difficult for them. They still can work on some short-term memory if they need to. So all you would do is you could use a note card or a piece of paper and write down the blue that says a blue polka dot goes once in the morning, once at night, or you can verbally tell them that. And each one has different colors, and they can easily just go and open the bottle, take out how many pills they need to, take it and put it in the pill sorter. Another great way to grade this up is if you have a label maker, you can easily make fake labels that have fake prescription names on them and fake dosages on them. Also a great way to grade and adapt this to grade this activity up. So all you would do is put fake labels on the bottle with the dosage and have them read it. So if this is near the end of meeting with your client through a few sessions, you can easily grade it up, and that just right challenge is what you're aiming for. So this kit allows you to really do that just right challenge for patients of any stage easily without having to redo the whole entire kit. So that is my kit. I really hope you like it, and have a great day.